Hospital made history in 2019 for successfully performing its first ever brain surgery.
Well, the hospital boasts of ultra-modern facilities, but what makes this facility tick? Mel Miendo tells us more.
The Machakos Level 5 hospital made history in 2019 for successfully performing its first ever brain surgery. After devolution, the hospital had a fully operational 6-bed critical care unit with specialized personnel, a dialysis center with 10 machines that catered for 10 to 24 patients, a cancer center, and a palliative care unit.
We have expanded our services. Initially, when I started working here up to about 4 years ago, we only had inpatient, outpatient, lab and radiology services and theatre.
The Machakos County government, through Governor Alfred Mutua, has laid emphasis on improving health services, with the sector receiving 35% of the county budget.
Anything we want as the health department, we can get it.
The county is now keen on improving the nurse-patient ratio to get to the level of 1 nurse for 15 patients and working towards the WHO ratio of 1 nurse per 6 patients.
I believe we are different than most counties. Last year, he also went ahead and employed another 85 nurses. This take care of the nurses who are leaving the country to go and work elsewhere, because there are many of them who are leaving, the nurses who are retiring. And under UHC pilot, as a pilot county, we also got another 23 who are on contract as per the UHC.
The maternity wing at the hospital boasts of 181 beds. Mikali Gitonga, currently a mother of 2, shares her experience.
I have 2 kids. The first one I delivered here in Machakos, and this is the second. After I got good services with the previous one, I came here back again because here doctors, nurses, the CEOs, the supportive staffs, they are very cooperative.
Every one of us, we work as a team. Then also the support from the management. If it's an agenda that we need to push forward, like we need linen for the patients, we are supported even from the county level and even from our governor.
Opened in 2016 by President Uhuru Kenyatta, this renal unit was the only one in the region at the time.
We started receiving UHC patients, that is universal health care patients, and that is free treatment. So they were quite triple the number we have.
On average, 20 patients are seen daily at the renal unit. One of them is Benjamin Kivuva, who had just finished his dialysis when NTV caught up with him.
No patients are booked. They may be many, but we book them. Like they do sessions twice a week.
It's the main waiting bay for Machakos Level 5 Hospital. This is where we receive all the clients coming in to seek services.
Mondays, Wednesdays and Fridays are the busiest days for the outpatient unit, with many clients coming in during the morning hours.
On a busy day like Monday, we see almost 1,500 patients since the UHC started. And before the UHC, we used to have like 500 clients, the whole hospital.
Machakos Cancer Care and Research Center was opened in August 2019. So far, they have received about 1,000 patients for cervical cancer care treatment alone. And on an average daily basis, they receive about 50 to 80 patients.
Cancer patients who have visited this center have done so through referrals countrywide. The lab based within the cancer center offers histology and biopsy processes, screening for breast, cervical and other cancer cases.
For the mixing of our chemotherapy, we have a chamber, one of the modern equipment, to protect the pharmacists as they prepare these drugs and the staff within the unit from exposure from the fumes of these drugs. There are usually 2 pharmacists who are preparing these drugs to counter-check.
The Machakos Level 5 hospital seeks to change the perception that public hospitals cannot reach the level of privately run facilities, and the journey to get there continues. Mel Miendo, NTV.